Thanks very much for Gregore Mielke. Is that correct?
Yeah.
Yes, for joining us today. I'll give a brief introduction before he starts. So he actually did his PhD in Pelotas in Brazil using the accelerometer data that many of you or some of you might be familiar with. And his PhD focused on socioeconomic determinants and health consequences of sedentary behaviour in adolescents. He then moved to Brisbane in Queensland. He looked for better weather and a nice place to work. And he's now an NHMRC Emerging Leadership Fellow at the School of Public Health at the University of Queensland. And his research focuses on measuring and understanding patterns of physical activity and sedentary behaviour across the lifespan and studying inequalities in population health. And I think he'll talk about most of those things in his talk today. I know Gregore in his role as a senior associate editor at the Journal for Physical Activity and Health, where we work together on that. And we met in person for the first time today, and it's a pleasure to have you here. Thanks for choosing us to visit, and you're on your short stay in the UK, and we look forward to hearing what you have to tell us.
Thank you. All right, should I
minimize it. Yeah.
that's better?
Yes.
All right. Okay. Good afternoon, everyone. Thank you all for coming and attending, and everyone who's online. I don't know where I should look this way. This way.
Look here. Yeah.
Yeah, my left side is my best side. Thank you for having me here. It's a pleasure to be here and be able to see present in person again and see face and see nods and that weird face. That's what this person is talking about. So it's much better than just looking at black screen. So today I'm going to talk a little bit about the research program that has been involved that focus on it's just broad title, but focus on understanding patterns of physical activity across the lifespan. So before I start my presentation, as UQ is based in Australia, I'd like to acknowledge the traditional owners of the citizenship of the lands on which UQ is built and pay my respects to the ancestors. I decided this seminar, I'm decided to invite you to explore some of the big unknowns that are facing our world today. And that's a nice sentence is the branding of the University of Queensland. So, and that's the big unknowns here. I want to take you into some discussions of understanding what I call here real life patterns or daily patterns of physical activity, life course patterns of physical activity, and how understanding those two streams they can be used to also improve understanding on the gender and socioeconomic difference in physical activity, but particularly for today on gender difference in physical activity. A little bit about myself. So I'm from Brazil, south of the country. It's the weather there is as good as it is in here. I did my PhD there in epidemiology. Initially, my plan was to become a coach, work with track and field, and for some reason I become an epidemiologist. I work with the Pelotas birth cohort studies, which some of you are aware, and I moved to Australia in 2016, 17 to do part of my PhD. And Australia was such a nice place, and I decided to stay there for a little bit longer. And now I'm working at the University of Queensland in the School of Public Health, but I'm mostly working with the Australian Women and Girls Health Research Centre, where I've been doing research with focus on physical activity. Still a little bit about myself, and sometimes I feel a little embarrassed by this picture, but that is me 15 years ago when I just finished my undergraduation. It's like one of the best 4 years of my life when I was an aqua fitness instructor. And the reason why I decided to share that is because when I was an aqua fitness instructor, that was a conversation that I had with my clients, which was quite recurrent. So I had my clients, most of them were mid-aged women who were getting to the classes and having, for most of them, their first experience with physical activity, with exercise or leisure time physical activity. And I was quite often getting that question here. So questions such as, what's the optimal dose of physical activity that I can do to X, Y, and Z? I was always referring to the physical activity guidelines and thinking, yes, it's never too late to become active, but at the back of my mind, I was always asking, okay, is that true? How is the evidence and how strong is the evidence that I can use to make those claims? So, and somehow these questions, they have been shaping they've been part of my research questions and the research that I'm trying to develop. And the truth is that we have well-developed evidence-based physical activity guidelines, which probably everyone here knows. But in reality, people, they accumulate their physical activity in many, many different ways. So we have the people who do their physical activity in just one single day of the week. And I relate to that when I play my football over the weekends. Some people are quite regular, but at the end of the day, we don't know exactly if there is an optimal pattern for physical activity or not, and what are the determinants of those different patterns. Because we have like more high resolution data now, we can also look at patterns of physical activity in different perspectives. We can now understand how physical activity varies across the week, across the day, and perhaps understand whether there are potential health benefits related to different patterns of physical activity. One limitation that we have in those evidence-based guidelines, and that we have in the research field as a whole, is that so far, everything that we know about physical activity and health outcomes, or most of what we know, was based on that classical epidemiological model, where we measured physical activity in one single point of time, which referred to physical activity of the past 7 days, 30 days, but from a really small point of time. We followed people for 5, 10, 15, 20 years, and we compared them in terms of health outcomes, mortality. But in reality, physical activity changes constantly across the lifespan. And when we think about the guidelines, we are not taking account of all those changes. And when we think about the evidence that we have, most of the time, we ignore, we don't take into account that those changes in physical activity across the lifespan. And actually also the measurement error that might be associated for actually measuring physical activity in only one single time point. Early this year, I got funding for this fellowship that I'll be involved for the next 5 years, which have this overall aim that is understanding or improve understanding about the optimal patterns of physical activity and sedentary behavior across the lifespan. And that fellowship, that research program that will be involved, has these three streams that will work in parallel. So one is what I call here understanding real-life patterns of physical activity. The second one is understanding life course patterns of physical activity. And the third one is measuring and understanding inequalities in physical activity when we consider and when taking account these patterns. So for the next few slides.
Should I just click this away because we have this annoying. Yes.
Okay, yeah, sorry.
No, it's not your fault.
So what I want to, I'd like to share with you in the next few slides is some of the research that I've been involved with our team at the University of Queensland on each of these streams. And at the end, bring some points, some thoughts that I have here that I would love to discuss on the challenges and the limitations that we think that we might have when facing and understanding, improving the understanding of patterns of physical activity, both daily patterns or life course patterns of physical activity. Okay, so when you look at real life patterns of physical activity, one of the studies that we conducted was this study where we looked at the participation in sports and recreational activities and incidence of hypertension, diabetes, and obesity in adults. The reason why we did that study was because when you look at the global report on physical activity and the guidelines, it's quite a lot we refer to sports and participation in sports as a strategy. But when you look at the evidence on the participation in sports and recreational activities in mid-age adults, we can't find many studies which actually look at participation in sports with an occurrence of health related outcomes. We have a few studies that look at mortality, but we don't have intermediate health outcomes. So in this study, we looked at the Habitat cohort study, which is a cohort of mid-age adults conducted in Brisbane. So it's a representative sample of Brisbane in Australia, where participants were recruited in 2007. Well, we had follow-ups in 2009, 11, and 13. And in each follow-up, they reported participation in sports and active recreation, but they also reported self-reported hypertension, diabetes, and BMI as well. So using this data, we looked at the longitudinal association, the association between participation in that list of 11 sports and recreational activities with occurrence of hypertension, diabetes, and obesity 2 years later. So for this analysis particularly, we excluded all participants who had hypertension, diabetes, and obesity. So we could look at incidence or new cases of these conditions. Overall, this is a summary of the findings. So here I'm sharing the associations between between participating in a list of sports at least once a week and occurrence of hypertension, diabetes, and obesity 2 years later. So when you look at the overall association here, we observe that those who reported participation in sports at least once a week, they had 15% risk reduction in the risk of hypertension, 22% risk reduction in diabetes, and 17% risk reduction in risk of obesity 2 years later. Overall, what we observed here was that a large variety of sports and recreational activities, they were associated with at least one health outcome or risk reduction of at least one health outcome. With only one activity not associated with any of the health outcomes, which was golf. Interestingly, weight training or resistance training here was associated with risk reduction of all the three health outcomes. In my point of view, the main finding of this study, and it wasn't the aim of this study to provide what's the best exercise, but we aimed here to provide some evidence that we can use a range of different activities to promote physical activity instead of just limiting to specific activities. Of course, we have limitations in this study. We need to think about the measurement. We need to think about the number of participants who were engaged with some of these activities. So here, when I said about golf, we had only 4% of participants who reported playing golf at least once a week. According to self-report measures, these participants, they were quite active as well. So these are all points that we need to take in account, and there are potential limitations of this study. We are also trying to look at the relationships between what has been discussed now and to what extent the intensity, frequency of physical activity they might provide extra benefits than just assessing total volume of physical activity. We are looking at, for example, for these analyses, which are some preliminary analyses yet, we are looking at the association between volume, frequency, and intensity of physical activity with incidence of hypertension and obesity and diabetes. It's not here in Australian women. So for this study, we are looking at the Australian longitudinal study of women's health. So basically, we have these 4 cohorts. We are just looking at 2 here of women who were born in the 70s and 40s, 50s, which have been assessed, responding to questionnaires since 1996, and we have information of physical activity and health outcomes collected every 3 years. So using this design, we can look and explore the associations between different profiles of physical activity in terms of intensity and frequency and occurrence of different health conditions. Just in the interest of time, I'm just going to refer quickly here to findings, some of the analysis that we are doing for hypertension. But basically what we did here is we created people with different profiles based on their total volume, intensity, and also frequency of physical activity. Using this self-report data, we observed that over 15 years, meeting the physical activity guidelines, which is in that range, or exceeding the physical activity guidelines, which is in that range of physical activity, was associated with reduced risk of hypertension. But that's not quite new, and we tried to look at something further. So overall, what we looked was to what extent adding frequency to the models of physical activity would add extra protection or not for incidence of hypertension in this study here. When you looked at the number of sessions that people reported per week, we did not observe any extra risk reduction, or there is no association with incidence of hypertension. When we looked at intensity, and here we have profiles of people who had the same amount or volume of physical activity with different profiles of intensity. So basically here we compared those who accumulated all their total physical activity without any vigorous intense activity. And here, those who did at least 2/3 of their total volume of physical activity with vigorous intense activity. What you observed was that those who had more intensity in their total volume of physical activity, they have extra risk reduction for incidence of hypertension. The main limitation of this analysis here, or the two main limitations, is that it is quite likely that when you look at the total volume of physical activity, this group here who accumulated most of their physical activity with vigorous intensity physical activity, they still had more volume of physical activity than the reference group here. So, but because of numbers, that was we could not explore further. Another limitation that we have here, and I want to discuss a little bit more about that at the end of the presentation, is we might also have an issue about the measurement here. So when you're measuring physical activity with self-report, it's likely that the quality of the report of vigorous intensity physical activity is much, much better than for moderate intensity activity. So, and when you are comparing relative risks, that might explain some of those differences as well. So, moving to the second part is, and that's where I think that our research team there can contribute more than this in the first part of understanding real life patterns, is looking at life course patterns of physical activity. So as we have this data from the Australian longitudinal study of women's health, or the Habitat study, which was the one that I showed before, We have data collected every 2 years, over 10 or over 20, almost 25 years. We can look at different patterns of physical activity across the lifespan. And that refers to the issue that I was mentioned before on the classical epidemiological model that we have that only assessing physical activity at one time point. And this is particularly important, I think, for women and women's health when we think about the reproductive age as well. Because when we are assessing just one time point, it doesn't represent the real story of physical activity for not only women, but for the cohorts that we are looking in assessing. And this is just one example of data that we have there. So if you look at self-report data in one of the cohorts of women who are in the reproductive age, which were followed since like from their 20s, from the 20s to their 40s. And if you just look at the proportion of women who reported or who are meeting the physical activity guidelines, you can see here that there is little variation in total in that proportion. So it actually varies from 50 to less than 60%, and with a small drop on their 30s to near to 40s. But when we are based to, we look at trajectories and we are able to model trajectory-based models, we can see here that there are participants with different, very, very different profiles of physical activity. We have those participants who are always active or always inactive, and they represent about 50% of the sample. But then we have 50% of the sample of participants who drop their physical activity, increase their physical activity, or have this drop and increase again. So again, this is just raise questions on the way I think that the way that we should be looking at the data and taking more that life course perspective into account when investigating your relationships between physical activity and health outcomes. We are looking now, one of the things that we are doing now is trying to explore the idea or to what extent we can build our physical activity bank savings. So we are using data from 8 surveys from the Australian Longitudinal Study of Women's Health and looking at the association between accumulation of physical activity over 20 years and health outcomes. And this is, again, some preliminary analysis that we are working, but in this figure here, we have the distribution of physical activity accumulated across over 20 years, and that's actually the average of physical activity over 7 surveys. We have the distribution here, and we have resting heart rate at age 41 to 46. So what we were able to observe was that those women who accumulated more physical activity over this 20 years period, they had lower resting heart rate than those who accumulated less physical activity. What was interesting actually was when we looked at profiles of physical activity, those who were active or moderately active, and these profiles of low, moderate, and high, they were based on the types of physical activity in different age, life stages. Those who were at least moderately active in at least one period, they were more likely, or they had lower resting heart rate than those who were always inactive. Still, we have limitations with this study. Here, we are looking at the idea of the accumulation of physical activity, but it might be the case that what we are observing here is just a better measure of physical activity, which is better represented when put together 7, 6 surveys than actually the accumulation of physical activity, but that is one way that we can look at that. We are also looking at this idea of accumulation of physical activity with some menopausal symptoms as well. So we are looking, for example, at hot flushes and reporting hot flushes. And overall, what we observed was that accumulation of physical activity was associated with less or report of hot flushes. When you look at the profiles, we observed something similar that we observed for resting heart rate. So regardless of the time and the profile, those who accumulated more were less likely to report hot flushes at age 43 to 46. We are looking at the idea of trajectories and profiles of physical activity with health costs as well. So in this cohort, we have access to the linkage data. So we can access data related to health costs and with medical costs and pharmaceutical costs. So in this study here, we looked at a cohort of what we call a mid-age cohort. And we looked at their physical activity data first in 2001, when they were 50 to 55 years old, classified them in inactive and active. When I looked at their physical activity data again 6 years later, this is the profile that we got. So 35% of them actually changed their physical activity status here. When I looked again 6 years later, we observed this profile here. So 30% of 1/3 of them were always active, 16% were always inactive, but more than half of those participants, they changed their physical activity status. When you looked at medical here at MBS or pharmaceutical health costs, we observed though that compared with those who were always inactive, maintaining the active status was associated with 40% lower costs with medical costs and 30% lower pharmaceutical costs. But also those who were active in at least one period of time, they had lower health costs overall than those who were always inactive. So, looking at the perspective of life course, I think it's important and to better understand and better shape future physical activity guidelines. We are also looking at how this perspective can be used to better understand gender difference in physical activity as well. And the reason why I think that is important, I'm always trying to bring that into the whole research program, is that we have been looking at gender difference in physical activity worldwide, and this is the picture that we have from self-report data. So when you look at data from 142 countries, there is only 3 countries in the world on where physical activity in men is lower than physical activity in women. And we've been arguing and pushing for the idea that if we want to increase populational levels of physical activity, closing the gender gap, that could be a solution, that could be a target that we could address. But that gender difference in physical activity, it's largely driven by gender difference, by how the gender difference in physical activity happens, change across the lifespan. So if we look at leisure time physical activity, and here I'm bringing some data from Brazil, when you look at the proportion of participants who meet the physical activity guidelines on their leisure time, in men here in green or women in yellow, you can see that across the lifespan, the gender difference is not similar. It changes across the lifespan. And mostly because, not because women become more active, but because men become more inactive. So thinking about that life course perspective on understanding health benefits, understanding how to tackle difference, I think it's something that we should always consider and take into account. not the only reasons, but one of the reasons why we have that difference, especially in the reproductive age, it's related. This is related to, might be related to pregnancy as well. And using data, using data from Brazil, from Pelotas, when you look at physical activity and how long it takes post-pregnancy for women to return to their physical activity levels, we have been observing that it might take up to 4 to 5 years post-pregnancy for women to return to their physical activity levels. So when you're thinking about guidelines of physical activity, I think that we should use the life course perspective and approach to understand to what extent having some period of life where inactivity might happen, actually they might have some deleterious effect. So that is why I think that taking account the life course perspective and approach on generating evidence and also driving guidelines is important. So the last 3 slides that I have here, or 4 slides that I have here, are some of the challenges and limitations that I think that we face in, I think they are particularly important for understanding patterns of activity, but are challenges and limitations that I think that we have in the physical activity world overall. The first limitation when we are understanding patterns of physical activity and understanding physical activity is always consider that evidence that we have and where the evidence that we have, where that data comes from. And this is a figure from the Lancet Series of Physical Activity in 2012, which demonstrates the mismatch of the evidence and where people live and what we know about physical activity. So if we want to drive change in physical activity and understand and create better evidence-based guidelines, mostly based on observational studies, we need to have a push and we need to think about generating more evidence from where people are living and not always thinking about guidelines and evidence using our knowledge generated in mostly high-income countries. Another limitation or challenge that we are facing now is that we need to be very careful with that picture of the random medical use. And the reason is that in physical activity research, we never had so much data available as we have now. So for example, if we just think about accelerometers, now we have hundreds of thousands of data. We have all these patterns of physical activity. We can see how much physical activity people do in the morning, evening. And we need to be very, very, very careful to not get trapped into not fishing. Fishing is quite a strong way to say that, but finding ways and identifying those little patterns of physical activity and say, yeah, that's the best thing that you should do, or just do it. And so I think we need to be very, very, very careful on the way how we are driving our findings and selling actually our findings as well. A third limitation that we have, it's more what I call here the epidemiological paradigms, is that we are trying to compare patterns of physical activity, and I'm always telling that to myself and always to keep that in mind. We're trying the classical epidemiological model, the classical epidemiological way that we use to compare patterns or profiles of activity or effect of physical activity between men and women, poor, rich, or different groups is using relative risks. And I'm just using here a very simplistic model where I'm using different intensities, but you could use here different groups. But overall, what we do is we calculate relative risks. We compare, we observe which group has the lowest relative risk, and we say, yeah, that's the best thing that you could do, or that's the strongest association. But what we overlook some the times is that relative risks, they are really driven by the reference group and the physical activity level that we have in our reference group. So if we just think about the way how the theoretical dose response relationship between physical activity and health is, where we don't have that clear linear relationship, we have instead a L-shaped relationship. If we overlook at the reference group and the physical activity level, the reference group, we might be making comparisons and which actually don't represent and can be used to say that one profile is better than other, or that the association only happens in one group and not in another. So I think these are some of the issues that we always need to take in account, and as epidemiologists, we need to consider. The second last issue is about measurement error, and was something that I briefly talked before. So when you're making comparisons and using relative risks, so we always need to be aware, and sometimes we overlook that, and I make my mea culpa because sometimes I overlook that as well. We ignore that relative risks, they can be influenced by the magnitude of error that we have in two measures. So if we have one measure that's more precise than another, and we have the same theoretical effect, it's likely that the association from the more precise measure will present stronger effects. So I think this is one thing that we need to take in account. And the last issue is that we are here discussing about patterns of physical activity. We are using accelerometers to identify what extent, frequency, intensity, duration of bouts they might be associated with physical health outcomes. But the question actually is, can we actually isolate those components? Can we isolate the fit components of physical activity, and to actually say that frequency is more important or intensity is more important? How can we explore the association between all these components and ignoring the other components? So just to summary and my take-home message, I think that with all the data that we have exciting times ahead. We have so much data that we can look now. We can go very deep and look all the potential profiles of physical activity across the lifespan, daily profiles of physical activity. But as epidemiologists, and we always need to be careful and be aware that methods matter. And in a time where data science is becoming so strong, we need to put our epidemiologist hats on and always take into account that methods is important. And some of the findings that we have in the literature, they are largely driven by the methods that we used in our research. And finally, I think that when you're thinking about patterns of physical activity, gender, socioeconomic difference in physical activity, and future guidelines, we always should take into account the life course perspective. We need to be very careful to avoid creating guidelines which tell people to be active all the time when sometimes life happens and you can be active, and we just create guidelines which put extra duty or on people. So with this, I thank you very much again for your time, and I invite you to come and visit the University of Queensland in the beautiful Queensland. But again, thank you very much for your time. Thank you for having me as. Thank you.